Chapter 15 covers the patient as an individual. The patient's well-being is affected by the attitude, expressed concern, and of course competency or technical skills of the healthcare providers. What makes professions in healthcare so very interesting is the fact that individuals are complex. Our patients are impacted by their culture, their personal experiences, and of course, their basic human needs. Every human being has worth. That is the philosophy of individual worth. And as healthcare providers, we need to give the same level of care regardless of that patient's circumstances. Some patients present unique challenges. They may be more difficult than others. There are a large number of reasons for this. They might be experiencing pain or anxiety. But we have to treat all individuals the same. Now, part of understanding our feelings toward others has to do with prejudice. Prejudices are negative feelings about people due to any number of things: race, cultural background, appearance, even age. But prejudices prevent us from seeing people as unique individuals. So prejudices is a way that we prejudge people without really knowing them. They found that most individuals have some prejudices, and what we need to do is we need to identify those prejudices in order to deal with them. We need to encourage positive health changes when necessary, and listen carefully to our patients and respect their own belief systems. Culture is very important in terms of patients' behavior, patients' perspectives, and we need to understand culture. Culture can include many different things: values and beliefs, social organization, family structure, language, religion, and even everyday activities. Every individual is influenced by his or her cultural background. Culture is helpful to a group of people. It provides guidelines for behavior, gives life some predictability, and provides a means for people to live together in relative harmony. Don't take your own beliefs and the way of life for granted and expect others to share them with you. So we come with certain perspectives from our culture, but we need to look outside the box in order to understand patients from different cultures. Customs vary among cultures, and the differences can cause misunderstandings. So we have to appreciate culture. Culture makes life fascinating and beautiful. It shouldn't be something that we are thinking of in a negative way. We need to think of culture in a positive way. It's very interesting, and as part of this course, you will actually do a cultural project with a team. So it's important to learn about other cultures, and especially those of likely future patients. If you're working in a setting in which you see a lot of patients from a certain culture, it's your responsibility to learn about that culture. When you work with patients from different cultures, you should never assume that the patients will understand you. You also should not assume that all within that culture practice the same customs, but be sensitive to possible cultural differences and different needs for those patients. Learn to ask questions to learn more about your patients and their belief systems, and recognize there are many cultural subgroups as well. Generally, there is a dominant culture in a society or a country. For example, in the U.S. culture, the dominant culture does value the importance of efficiency, punctuality, shakes hands when meeting new people. But there are also subcultures, and those subcultures may have different values and different behaviors. So individuals might have customs from a different dominant culture or a subculture within that dominant culture. One part of culture has to do with personal space, and this often becomes important in healthcare. There is a space, and it is different from culture to culture, where people feel comfortable holding a conversation, a casual conversation. It's this distance that can vary among cultural groups. For the United States, it's about 18 inches between you and a friend or family member. For some cultures, it's less than that, and that can feel uncomfortable. Touch is very relevant to discuss in healthcare because touch, whether it is appreciated or whether it is considered forward or disrespectful may vary depending upon the culture. Now, part of performing an examination may require that the patient be touched, and therefore it's very important that the procedures explain to the patient before performing it. And it's also important that you're respectful of cultural beliefs with regard to touching. There are other healthcare beliefs that vary among cultural groups, how different groups define good health, how they define the causes of disease, what they accept as methods for treatment. In the United States, the medicine that we use is traditional Western medicine. It's practiced by most physicians, and it focuses on the physical aspects of the body, and it is very highly determined by scientific methods. But it doesn't always take the entire body into account, which is different from other cultural practices around medicine. A holistic approach includes both the mind and the body. Religion and healthcare can also intersect. So, in many cultures, religion becomes part of healthcare. And this is important, again, to not only recognize but respect when you're talking to patients. For many cultures, harmony is extremely foundational when you're talking about health. So it's the balance of body, mind, and spirit. And focusing only on the body, as is often done in Western medicine, is considered inadequate. In the United States, interestingly, we are becoming more interested in some of these holistic medicine practices. So when you hear about yin and yang, or cold and wet versus cold and dry, hot and wet, hot and dry, really these are different ways of describing balance. So as you move forward, it's important to understand the cultural perspectives on health and appropriate medical treatment. One place where we see more acceptance in the United States is herbal medicine. It's been used for thousands and thousands of years, and it's commonly used today. Often described as a natural remedy, but it's very important to keep in mind that plants have bioactive components. In fact, quite a few of our medications come from plant compounds. So those herbal medicines, even though not controlled by the Food and Drug Administration, can interact with other medications, can cause side effects, can occasionally, or more often than occasionally, cause some problems. So before using them, you should check with someone who is very knowledgeable as far as the proper use and whether this can cause a problem, because they certainly can be harmful. And with that, it's important to go on to the response for this mini lecture.